Hi, good morning, everybody. Welcome to the Brilliant Health Community Facebook group that we host once a month. We give you some updates about the COVID-19 pandemic, some tips, and then also I'll go a little bit more into what my article was this month about sea vegetables, or as I used to just know it as kelp and seaweed. Anyway. I guess some of the biggest things are that the CDC has changed how it presents a lot of the data. Right now it is saying that most of the country is in low transmission zones, and we are actually also included in that in Maricopa County in a low transmission zone. Of course, that being said, COVID-19 is still out there. We are seeing some cases of it. In fact, I have two unfortunate family members, extended family members who got it. They've been very careful. They probably also got that BA2 lineage, which does seem to be a little more transmissible. It's one of the Omicron variants, and that does seem to be the dominant one that's starting to circulate. It is still the best thing you can do for yourself is get vaccinated to protect yourself against severe or even hopefully decrease your chance of getting long COVID or severe disease that lands you in the hospital. The two vaccine series is recommended for the kids 5 to 11 years old. There is no booster yet recommended. That may come sometime in June or later. For everybody over 12, it is recommended that you get the booster, so that you get 3 shots. For everybody over 50, and especially if you have some sort of underlying or chronic medical condition, get that second booster. So you would be getting 4 shots. I want to also remind everybody that the kids who in the under 5-year-old range have no vaccine yet. My little boy is unvaccinated as well, falls into that category. There may be some vaccines on the horizon, potentially coming out in June or sometime after that. Right now they're still doing some ongoing trials, especially with Pfizer. Moderna has already submitted some data. For people who are severely immunocompromised, so this includes people with a solid organ transplant, they're on immunosuppressing medications, maybe for rheumatoid arthritis or some condition they have, I'd really encourage you to talk to your provider about Evusheld. It's a monoclonal antibody that you get prophylactically, basically before any exposure, and it's protective against severe disease. So it's people who may not have mounted a good response to the vaccines initially. Also, the conditions of what qualifies as a condition that leads you to higher risk of getting a serious complication has been ironed out a little more clearly. Definitely diabetics, people who've had a cerebrovascular event such as a stroke, cardiac issues such as coronary artery disease, being overweight or obese, having chronic kidney or liver disease, COPD, moderate to severe asthma, pregnancy or even up to 42 days after pregnancy, having a cancer diagnosis, or even having depression or being inactive are actually listed as higher risk health conditions. And I would say right now, I know a lot of people have questions. How do we protect ourselves if we're going to be flying? We have a lot of snowbirds who are planning on going to summer nicer weather vacation locations than we will have here in Phoenix in a few weeks. And you actually are relatively safe while the plane is flying because the filters are working. It's really the time of taxiing or landing when they're not running. Those are your highest risk times of catching something. So I'd say wear a good KN95 mask at a minimum during those higher risk times to protect yourself. Also, if you do plan on traveling, good idea to carry, especially if you're going somewhere more exotic, carry the rapid home test kit with you, so if you do get symptoms you can immediately test to know. And if you are somewhere, where we could maybe help you get a prescription for an antiviral if you qualify, of course we want to know if you got COVID. So do remember Paxlovid, that's the brand name of the antiviral, meant for people who are at high risk of progressing to severe disease. So a lot of those conditions I listed, there would be those people who should get it. All right, so I think that's pretty much a sum up of the COVID situation that we're in right now. Moving on to my article, it seems like people are getting more interested in what we can get from the sea. And we plant a lot of our vegetables in the soil, and there's been great talk of, well, a lot of the soil's depleted, we're not getting all the micronutrients and minerals that we normally would, or maybe that we did 60 years ago. So the sea is actually a good place to get some vegetables, the most common one being seaweed or kelp. And doing this article, I learned there are so many more varieties than I even thought possible. So it's been interesting doing that, and plan on trying some of those. There is an association between people having seaweed and living longer, having a longer life. Of course, association is not causation, so I have to stress that. But still, it's very interesting. I didn't know that all the hydrated seaweed that you see that may not look as appealing, you can rehydrate it quite easily. And that's something very interesting to me. You can easily make it into something very edible and palatable. So the different kinds are wakame, dulse, and kombu. I think the wakame is like the seaweed. If you go to a Japanese restaurant, you often get a seaweed salad. That's wakame, sorry. And yeah, there are different ways to eat it. You can use it in soups, on salads, as a condiment, of course, wraps for sushi rolls, etc. There are these blue zones in the world, and they call that because they have a high percentage of people who live well into their hundreds. There are a couple of them. I think one's in Costa Rica. There's one in Okinawa, Japan. And they definitely are eating a lot of sea vegetables in Japan. So, that's an interesting little fact. We do know that seaweed has a really good source of some minerals. It has iodine. So we don't make iodine in our body, and our thyroid needs it. We don't want to give ourselves too much, so that's where I'd be careful. If you're using an iodine supplement, I'd be very careful with that. I think more stick to how much you would get from food. And as you know, a lot of salt has iodine in it, except we're often now switching to sea salt and things like that, and that does not have iodine. So you could definitely get a good iodine source from kelp, seaweed. It's also rich in vitamin A, C, potassium, iron, calcium, magnesium, and it's actually one of the few veggies out there that contains vitamin B12. And that, for vegetarians and vegans, it can be a challenge to get enough B12. So that's a good one to actually have on your list if you want to try and get that in a natural form. And similar to the land version, which I would say is kale, seaweed can really help protect your gut because it has some prebiotic properties, and it does contain polyphenols. And as Dana will tell you, the polyphenols are so important for maintaining good gut diversity, good gut health. So all colors of the rainbow is what we want to eat. It does seem to also have some protection against obesity. There was a study done in mice. It showed those that were fed a high fat diet, even if they had the high fat diet, if they had the sea vegetables, they excreted more fat and they had less systemic inflammation. So that's not, again, it's a study in mice, but it's interesting. It also contains a compound that seems to inhibit cold sore virus from replicating. So I don't know like how much you would need to have that benefit, but again, an interesting thing. It has dietary fibers, it has those polyphenols, it has peptides, lipids, and minerals that help prevent and treat cardiovascular issues. So overall, it's a pretty good vegetable in itself that really has a wide range of potential benefits. Now, you don't want to go and just make your whole diet seaweed, because then you're probably going to get too much iodine, and the kombu variety in particular has the highest level of iodine, because that could potentially cause Hashimoto's thyroiditis or affect your thyroid. Also, I'd recommend getting an organic brand. It's less likely to have heavy metals. Or you can see if they test their seaweed for heavy metals. If you are taking a medication such as warfarin, you need to be careful, because that's affected by vitamin K, and there's vitamin K in the seaweed. So you'll need to either eat that similar amount, every day, or make adjustments. So for now, I'm probably not going to go out of my way to eat a whole lot more, but I was pretty excited at the idea of incorporating it in some soups. And even just making a broth, they say, from the dried seaweed, just make a really good mineral-rich broth, and use that as a base for something else. So it was an interesting article for me to make. As in anything, moderation is key. So not too much, not too little of anything. Well, I hope you're all having a good day, and thanks for joining us this Friday. Okay, bye-bye.